Hello and welcome to another lecture for Introduction to Psychology. In this lecture we will be talking about sleep. So we're going to look at things like the continuum of consciousness, look at conscious versus unconscious as well as in between. Then we will look at sleep and dreams, the rhythms of consciousness, which basically is the rhythms of sleep. And then circadian problems and treatments, so issues with sleep. We'll then look at the stages of sleep, seasonal affective disorder, some theories of dream interpretation, but we're going to blow through that pretty quick, and then sleep problems and treatments. Getting right into it with the continuum of consciousness, this is basically going to look at the different states of consciousness that exist. And we're only going to look at kind of 2 or 3, but we're not going to really get into the specifics. But want to point out that we're looking at the different levels of awareness of one's thoughts and feelings that you have, all the way from unconscious to conscious, but there are levels in between that we look at. So we refer to it as a continuum of consciousness. So you go from being acutely aware and alert all the way to totally unaware and unresponsive. And the things that happen in between, like daydreaming and altered states of consciousness, that type of thing. So looking at these different states, we'll look at first basically controlled process. Controlled process is where you have full awareness, alertness, you can concentrate, and you are basically consciously aware and thinking. And yeah, then we'll go on to automatic process. This is something that requires little awareness and takes little attention, doesn't interfere with other ongoing activities. So this is going to be something like when you're driving a route you've driven many times before. It becomes automatic. If you try and think back of what happened during that driving, you can't really remember everything. There might be specific periods of time where you went from automatic to controlled, like if somebody lane changes in front of you, if somebody does something around you that makes you bring back to consciousness. But overall, the automatic processing is where you've got little awareness and your mind can possibly be thinking about other things, listening to the radio, thinking about what you're going to be doing at work that day, stuff like that. Daydreaming is another thing that requires low levels of awareness, and it's something that can occur during an automatic process. And this is essentially where you're dreaming while awake, where you have little or less control over what you're thinking about, hence the daydreaming or fantasizing. Or dreaming, you have much less control, but daydreaming, you have a little bit of control, but mostly daydreaming is just where your mind is wandering without active control. Then we have altered states of consciousness. So for this, we're going to look at a couple different altered states, but it should be pointed out that the top level of altered states we look at is where we look at things like hypnosis, lack of sleep, drugs, things like this that produce an awareness that differs from our normal consciousness. So meditation is counted as an altered state when you reach true meditation. I'm not going to get into that too much. I'm not a big person who has looked into these altered states of consciousness when it comes from things like meditation and yoga and things like that. But I will say that when we talk about the top level of altered states, we are looking at essentially these times when our perceptions are not normal. And then at the end is unconscious, and this is where you've got complete lack of sensory awareness, complete loss of responsiveness to an environment. This can be from a disease, a trauma, a blow to the head, anesthesia, different things like that that essentially put you to unconsciousness. Now, you notice I haven't mentioned sleep directly. I mentioned it in Altered Consciousnesses, but not directly in the slides. That is because sleep is counted on the spectrum, but not the same. So sleep is more of a low level of altered consciousness rather than unconsciousness. Because unconsciousness is where you have no sensory awareness and a complete loss of responsiveness to the environment. When you are sleeping, you still have sensory awareness going on, even if it is very muted. And you have responsiveness to the environment, again, even though it's muted. So if something loud happens, loud noises, something crashes in the house, or somebody touches you while you're asleep, that will bring you back to a higher sense of awareness. Whereas if you are unconscious, those types of things do not do that. So we should have this difference between sleep and dreams and unconsciousness. So sleep and dreams is counted at the lower end of the altered states of consciousness. Getting into sleep. So sleep, it consists of 5 different stages. Each of these have different levels of awareness and consciousness that are going on. So each of these have different levels of physiological arousal, meaning your body temperature, your heart rate, your breathing. And the deepest state of sleep does border on unconsciousness, but it is not quite there. People who are really hard to wake up, really hard to get a reaction out of, they're getting more towards the unconscious, but they still have consciousness. It's just they're close to it. And then dreaming is basically a state of consciousness in which we're asleep, but we experience visual, auditory, or tactile images. I mean, and shouldn't have to explain this, but dreaming is when we basically have different, we see and hear and even feel different things that aren't there. As I said, I'd come back to these rhythms of consciousness. So the last was the spectrum of consciousness. Now let's look at the rhythms. What I mean by the rhythms is what is happening with the body between consciousness and unconsciousness, or between consciousness and sleep. So the rhythms of what level of awareness we're in. And essentially the point here is that humans have an internal clock that, depending on how your clock's set, it regulates our physiological responses at different times in different ways. So when you first wake up, you're less likely to have a fast reaction time. Your fastest reaction time actually comes in the afternoon. If you look at this here, where about 6:45 you get a rise in blood pressure. This and these numbers here, I should point out, are the averages. They're not the same for every person. They're going to be different from person to person. So these times are basically you're going to be unique to each person. But let's look at a general person. The sharpest rise in blood pressure, 6:45. Melatonin secretion stops at 7:30, meaning you're likely to start waking up. 9 o'clock, highest testosterone secretion. This is why when I did my study on mate retention that I talked about at the beginning of the semester, and I tested testosterone, one thing I had to do was I had to make sure that my studies were done at a specific time of the day, and that was kept constant. That's because there's higher levels of testosterone secretion at different times of the day. You look here, you've got fastest reaction time at 3:30, greatest efficiency of muscle strength at 5 p.m. after waking up at 8 p.m. Then you go into the evening, and 9 o'clock melatonin secretion starts, and you hit sleep, and then deepest sleep at about 2 a.m. So you see that we've got a biological clock that we follow. Next is the circadian rhythm. So the circadian rhythm is basically related to this biological clock, but this is more going to be about how our body reacts in wakefulness and tiredness throughout the day. So it's our responses throughout a 24-hour day that determine when you wake up and when you go to sleep. And I always talk about here when I'm talking about this, I have a circadian rhythm disorder. I was diagnosed with it early on, actually when I was in the Army. But I almost failed out of high school because I would sleep in every morning. I had 3 alarm clocks in my room, 2 of them were across the room, and I would in my sleep turn these alarm clocks off. I got to the point where the secretary of the school, if she noticed that I wasn't there for first hour, would give me a call, and that would fortunately wake me up. I didn't know what was going on at the time, but it turns out I had a circadian rhythm disorder, and that is my body wants to sleep at a different time than than normal. So my body actually wants to sleep during the day up until about 1, 2 p.m. and then wake up, and then I have difficulty going to sleep at night. And I've always had this. I've gotten better now, but great difficulty falling asleep at night unless I go to sleep later, and also great difficulty waking up before a certain time. And this has really affected a lot of my life because most people run on a daytime circadian rhythm, and mine runs on a nighttime circadian rhythm. Along those lines, people with circadian rhythm problems things like shift workers will have problems with this. So my body naturally wants to be awake at night. For a while after I got out of the Army, I worked third shift because third shift was the easiest for me. Some people have a lot of trouble working third shift. Third shift worked out perfect for me. So because we have this internal clock, forcing people to work shifts that are not at their time means people feel sleepy. They can fall asleep at the wheel. They're less attentive and alert, can be moody, have aggression issues, things like that. And so what's going on here is that if you get people who are being forced to wake up at times, like at third shift or even early first shift, that is not what their body wants to do, it can actually cause behavioral issues. And then there's jet lag. Jet lag is where when you shift time zones, so you go, let's say, from Michigan to Europe, and there's a 6-hour difference, 7-hour difference, depending on where you are in Europe. So you at your normal circadian rhythm is now thrown off by the sun being at the wrong time. This is one of the benefits that I have to having a circadian rhythm disorder is I never experience jet lag. I travel a lot to international conferences, things like that. I see other people that are just floored for days on end after getting to a new location because of jet lag, and it just doesn't affect me. So that is the one benefit I have of having my circadian rhythm disorder. But jet lag can be pretty detrimental because it can cause all of these issues when people's internal clock and the sun are at different times. Well, what can you do to solve these problems? One of the things that's one of the main treatments is light therapy. So light therapy is where bright artificial lights can help us reset our clocks. It can help fight insomnia. It can help with people who are suffering from jet lag or shift work. So essentially what it does is it starts to train the body or fools the body into thinking that the sun is up at a different time than it's actually up. Another type of treatment is melatonin. So melatonin its secretions start at night. Talked about that with the clock we were talking about earlier. And it plays a big role in regulating the circadian rhythms. While taking melatonin in the evening, especially if you have trouble sleeping, can help you sleep and help regulate their circadian clock. Let's shift into talking about the stages of sleep. So the stages of sleep, it said before there was 5 stages, but let's look at these. So there's basically major changes to the body that occur as you pass through these different phases. The alpha stage is basically the first stage, not the first phase, but the first stage, and this is where you are awake still, but you feel relaxed and drowsy. So it's when your eyes are closed, but you're still awake. So this is what is classified as the alpha stage. This fact that we've got different physiological responses means it's actually pretty easy to start to track the stages. I myself wear a Fitbit that tracks my sleep stages, so when I check the next day, I can tell when I was in REM sleep, when I was in deep sleep. We'll talk about those in just a minute, but that it's nice that we understand enough about the stages of sleep now that something as simple as a watch can track what stage of sleep we're in based on things like our heart rate. So the first stage of sleep, the first phase of sleep is about 80% of our time we spend in, or I shouldn't even say this, we aren't even in the first phase yet. We're still talking about just the difference between alpha stage and non-REM sleep. So non-REM sleep, you spend about 80% of your time. REM meaning rapid eye movement, meaning when you're dreaming. And REM doesn't necessarily mean you're dreaming, but we look at REM as the phase when you dream. So non-REM sleep is when you're asleep, but you're not dreaming. As the slide says, we spend about 80% of our time that we sleep in non-REM sleep, and this itself is divided into 4 stages. So we've got 4 stages plus REM sleep, and these are our 5 stages or phases of sleep. We begin with stage 1, and this is after we've fallen asleep. We are in a very high state of consciousness. So let's just flip slides and start talking about that on the next slide. So stage 1, we're in a high state of sleep, a very low state of consciousness. It is when we are transitioning from wakefulness to sleep. And stage 1 typically only lasts 1 to 7 minutes, and we typically only are in stage 1 at the beginning and the end of the night unless we wake up for an extended period of time. Waking up does not put you back. Waking up in the middle of the night where you wake up and then go back to sleep immediately doesn't put you into stage 1. So stage 1 is really only reserved for the beginning and the end of the night unless you're awake for an extended period of time, more than 10 to 15 minutes in the middle of the night. Then stage 1 will happen again when you go back to sleep. But typically we skip stage 1 when going back to sleep when waking up in the middle of the night. This is where we gradually lose responsiveness. This is where we basically have drifting thoughts and images. When you're first falling asleep and your mind is drifting, this is where you're almost like you're dreaming, but you're not dreaming. And in the brain, theta waves are occurring, and this is one of the ways we can tell that you're in stage 1 of sleep. Stage 2 of sleep is basically the beginning of what we truly know as sleep. We get high frequency bursts of brain activity, muscle tension, body temperature, and heart rate start to decrease. And once you've reached stage 2, once you've gone from stage 1 to stage 2, it can be more difficult to wake someone up. So someone who's still in stage 1, you say their name, boom, they're back to consciousness. Someone who's in stage 2, this is the stage where saying their name won't necessarily bring them back. Some people are really light sleepers, this isn't necessarily the case, but stage 2 is where basically our body shuts off. And what do I mean by that? Our body shuts off, meaning we lose conscious control of body movements. This is actually very important. People who go to sleep who don't have this body shut off end up doing things like when they start dreaming, they start physically acting out their dreams. and this is where things like, we'll talk about it later, but sleepwalking and other things like that can occur if the brain doesn't shut the body off right. Then you've got stages 3 and 4. I put these together because really these are the low stages, the deeper stages of sleep. It should be pointed out that we don't reach stage 4 as much as we think we do, but we'll get back to that. So what is going on here? This is where the slow brainwave delta waves are occurring in the brain. These are very high amplitude and very low frequency delta waves that are going on in the brain, and this is linked to a lot of things like memory consolidation. So these stage 3 and 4 are important for memory consolidation, as well as the body going into a relaxed recovery state. So stage 4 is considered our deepest stage of sleep. It is the stage that you're most difficult to be awakened from, and it's when all of your things like your heart rate, your respiration, your body temperature, all of those are at their lowest. And during this time, you get the release of growth hormone, and this is responsible for physical growth, brain development, metabolism, all of these things. So this is why stage 4 is very important. So stage 4 is really that part of sleep that results in positive development for the individual. And I said before, we don't necessarily reach stage 4 that much when we're sleeping. From my experience, in 8 hours of sleeping, it's typical to reach stage 4 for only about an hour to 2 hours, depending on how well you sleep, things like that. And if you remember back to, and you can even look at the thing here, but if you remember back to the slide where it talked about the waves, or how we go down to stage 4 then back up, we typically only reach stage 4 early in the night. So if you sleep for 8 hours, you by hour 4 you no longer reach deep sleep anymore after that. You can still reach stage 3, but you don't tend to reach stage 4 after about 4 hours, 3 to 4 hours into sleep. Sometimes it can occur, especially if you've got sleep deprivation leading into the sleep, but typically stage 4 is reserved for the first half of sleep, or the first part of the night. Then on the other hand, you've got REM sleep. This is about 20% of our sleep time. So REM stands for rapid eye movement, and it's basically when the body is dreaming. So it's got waves of high frequency, low amplitude. The brain is in a state that is very similar to being awake and alert, except you've got functional paralysis. So that's what I was talking about earlier, where the body shuts off. The term for that is functional paralysis, where the body is paralyzed even if the brain is still active. We tend to go into REM sleep about 5 or 6 times in the night, but it's actually probably more than that. And we spend about 30 to 90 minutes in it. And when we go into REM sleep, we tend to be in it for short periods of time, 15 to 45 minutes, and it's pretty typical to be in it for about 15 to 20 minutes and then go back into the deeper stages, and then come back up to it and then go into the deeper stages. And I already talked about this some, so I'm not going to spend a lot of time here, but one of the issues is that if the muscles aren't paralyzed during this time, the sleepers can act out their dreams. If you're fighting an attacker in your dream and you start swinging and hit the person that you're in bed with, or get up and start walking around, possibly even into traffic and things like that. So this can be an issue. There's also another thing relating to REM, and that's REM rebound, and that is if you are deprived of sleep, you're not getting enough sleep, you're getting very little sleep, what we tend to do is spend more time in REM in the night to night, few nights after, usually just the night after. We spend more time in REM. The issue here is by spending more time in REM, we're spending less time in other phases of sleep that are also needed. So it's why sleep deprivation isn't necessarily a good thing, especially for memory. If phase 4, if stage 4 deep sleep is really tied to memory, then sleep deprivation is going to have an issue because we're not going to be getting as much stage 4, especially when the night after sleep deprivation we spend most of the night in REM sleep. Or not most, but more. Just some general questions or responses that people have to sleep. 16% of adults sleep less than 6 hours, and then 26% sleep 8 or more hours a night, with the average being 8 hours because those who sleep 8 or more tend to pull it up by being skewed in that direction. That being said, these numbers, I would not fully trust them, because the more we study sleep and the more we know about sleep, the more we realize that many people think they're getting more sleep than they are. So that person who thinks they're getting 8 hours of sleep because they went to bed at midnight and got up at 7:55, well, they got 8 hours of sleep. Well, the problem here is they don't realize that, well, it took them 10 minutes to fall asleep, 15 minutes to fall asleep. Let's just say 10 minutes to fall asleep. Now they're down to 7 hours and 45 minutes. And then when they already rounded up, but now we're down to 7 hours and 45 minutes. But they also woke up 5, 6, 7 times in the middle of the night and weren't even aware they were waking up. So one thing Fitbit really opened up my eyes to wearing it and track my sleep is I spend about an hour to an hour and a half every night awake that I'm not remembering being awake. It's when you're getting up to that high part of 2 and you wake up for a minute. You might wake up, go to the bathroom, you might wake up and roll over, that type of thing. But we're waking up, and it's even if it's for 10 seconds and you don't remember it, you wake up a lot throughout the night. So that now that 7 hours and 45 minutes, take an hour off from that, now you're down to 6 hours and 45 minutes. Maybe even 6 hours and 15 minutes, depending on how much you woke up. So someone who thinks they're getting 8 hours of sleep in a night might be only getting 6.5. So that's why I say really question these numbers, because these numbers are, again, self-reported, and people who aren't tracking their sleep don't realize how much less sleep they're getting than they think. So why do we sleep? This is more biological side, but there's two big theories that come into why we sleep. That is the repair and adaptive theory. The repair theory basically says that sleep helps us restore the body, and the adaptive theory is basically that sleep helps us not use up resources in the night when we are, especially when there's nocturnal dangers and predators, we're not using up resources in the night when we don't have to. At a time when we can't gain resources, we're not using them. So we put our body into a state that uses much less resources. How about what if I miss sleep? There's some big factors of missing sleep. A compromised immune system is one of the biggest. We'll talk about stress later, but an increased production of stress hormone and other risk factors for heart disease is one of those issues. Increased risk of obesity and diabetes all come from lack of sleep. The brain has effects, so you are more likely to be irritable. You have more difficulty with decision making. You have more difficulty with concentration. And even beyond that, one of them I've mentioned a few times is we have trouble with memory. We spend time during our sleep consolidating memories, and if you're not getting enough sleep, you don't consolidate your memories properly. Another thing related to sleep is what's called seasonal affective disorder. So seasonal affective disorder is when a person has depression or depressive symptoms during certain seasons when there is less sun. So our body basically regulates our clock off from the sun. Well, if you're in a more northern climate, if you're in more northern areas. So we look at places like Finland, Scotland, stuff like that, where and even Alaska, where the days are much shorter in the winter, they're much more likely to have seasonal affective disorder. And what happens during this time, you get excessive sleepiness, overeating, weight gain, craving carbs, lethargy. So what is basically looked at now is that this is now considered a subcategory of major depressive disorder. It's a specifier for it because so many people have this issue. And just like fixing circadian rhythm, light therapy is one of the biggest ways that is done to work on or to treat seasonal affective disorder. Because the body is essentially not getting enough sun, that's one way to help it, to trick the body into thinking there's more sun. Just looking at this, I already talked about like northern areas, but when we look at this, in Florida, there's only 1.4%, so it's much sunnier. But in less sunny areas, like Iceland, New Hampshire, northern areas, it's much higher rates. Why are some people less susceptible to it, like Iceland? And that comes down to likely genetic differences, but also other differences, cultural differences, things like that. I said I'd talk about dream interpretation a little bit. I'm going to go through this pretty quick because I'm not a big fan of dream interpretation. There's not a lot of evidence for any of these theories being correct, but I talk about them because there's been a lot of basically theories that have been proposed of why we dream. So Freud's dream interpretation was basically that the dreams are protecting us from our threatening thoughts. There's the extension of waking life theory that the dreams are reflecting the thoughts, fears, concerns, problems, and emotions that we have while awake. There's the activation synthesis theory that dreaming occurs because brain areas that provide reasoned cognitive control during waking state are shut down, so our brain is basically compensating for that. The sleeping brain is then stimulated by different chemicals that result in hallucinations, delusions, high emotions, bizarre thought patterns, and that's what we call dreams. The threat simulation theory is that the dreams serve a biological function by repeatedly simulating events that are threatening in our waking lives so that we can practice how it perceives those threats and rehearse our responses to those threats. So very similar to the mirror neurons thing that we talked about. But again, dream interpretation, there's a lot of theories into it, but there's not a lot of research that's been able to support it. In part because it's really hard to make a falsifiable study in the domain of dream interpretation. So let's talk a little bit about some issues with sleep. The first one we're going to look at is one of the main ones people have, and that's insomnia. And this is when you have difficulty either going to sleep or staying asleep through the night. And people who have insomnia tend to have fatigue, difficulty with concentration, difficulty with memory, and just not a positive sense of the world and their life. And insomnia can be really detrimental, especially if you're not getting enough sleep as a result of it. So there's been a lot of studies that have done on it. There's a lot of research that's done, and it's why there's a lot of treatments for insomnia, which we'll get to on the next two slides. So looking at, well, what are some treatments for things like insomnia or things related to insomnia? Because insomnia isn't one thing. It's a broad spectrum of things that could be causing it. Well, there's a plethora of non-drug treatments. Go to bed only when you're sleepy. So laying in bed for long periods of time actually can affect your ability to fall asleep in that place. Don't read or watch TV right before bed, because this, especially if you're already sleepy, this just wakes the mind up. If you're not asleep after 20 minutes, get out of bed and relax in another room until tired again. Really, and what this is kind of getting at is the only thing you should be doing in bed is sleeping, or other things if you do it, but I'm not talking about that. I'm talking about, don't sit on your phone in bed. Don't watch TV in bed. Don't study homework in bed. Why is that? Because during that time, you're training your body that that bed is used for things other than sleeping. You need to train your body to be that that bed is for sleeping. And when you get into it, it's time to fall asleep. Set an alarm for the same time each day, even on days where you don't have to wake up. Don't nap during the day, unless that's because that can affect sleeping. If you don't have sleep issues, you can nap, but if you do have sleep issues, you shouldn't be napping. And follow a program very rigidly for several weeks to see if it's going to fix your issues. There are also drug treatments as well. Benzos are the most common. These are things that are designed to reduce anxiety, worry, and stress, but they tend to they tend to aid in falling asleep. When I got diagnosed with my sleep phase syndrome, the circadian rhythm disorder, I got diagnosed Restoril. All it did is it knocked me out, but I didn't wake up rested ever after taking it. So it's not something that worked for me. Then there's non-benzos like Ambien that are faster acting, and they will reduce daytime drowsiness and tend to have fewer cognitive side effects than the benzos and are less likely to lead to dependence. But I tried Ambien too, and it had pretty much the same effect. It knocked me out, but I didn't feel rested after waking up. So if you really have trouble sleeping, the drugs are a possibility, but I'm not personally a big recommender of it unless nothing else is working. Another problem with sleep is what's called sleep apnea. And sleep apnea is where you have repeated periods of time while you're sleeping where you stop breathing for up to 10 seconds, sometimes longer. And that might happen repeatedly. During this time, you might momentarily awaken and then resume sleep, oftentimes without even realizing it. So this results in, it's a form of insomnia that results in exhaustion during the day. And essentially what's going on here is the body is snoring, and while you're snoring, you stop breathing. And a lot of people have this now. It's highly correlated with obesity, so being overweight can result in it. And essentially what's happening is, by stopping breathing for 10 seconds, sometimes longer, as I said, you wake up, you don't realize you woke up, and then you go back to sleep. And instead of that, as I said, you're in bed 8 hours and you're actually getting 6.5 hours. Instead of that, you're actually getting 5 hours of sleep, 4 hours of sleep, just because you're waking up so much without even realizing it. There are treatments for this. One of the main treatments for this is a CPAP machine, which is a breathing machine that helps you basically breathe and controls or stops the apnea. Narcolepsy is another sleep problem. This is where you just have excessive sleepiness during the day, even when you're getting proper sleep at night. It can even occur where you fall into sleep really quickly, relatively quick compared to normal, and falling into even REM sleep relatively quick. And there's a lot of things that can cause this, but one of the issues here is if it occurs while you're driving or walking, you can get injured from it. Another sleep problem is night terrors. So night terrors, these occur in stages 3 or 4 of sleep. Need to be very clear. Night terrors are not nightmares. Night terrors are when you have a frightening experience. Kids who have night terrors, and it's much more common for kids to have night terrors than adults, but when kids who have night terrors may wake up in a piercing scream. They are suddenly startled awake, very fearful, very rapid heart rate, increased breathing, things like that. And even after waking up, the kids will usually have no memory of the experience in the morning after they go back to sleep and have no memory of it. So again, it's very important to note these are not due to nightmares because they're not happening in REM sleep. They're happening in stages 3 and 4 of sleep, or deep sleep. And one of the things that's been found here is people who have more anxiety tend to have more night terrors. And what is believed here is when the body goes into these deep sleep, the body is truly relaxing. And people who have anxiety, that actually causes their mind to freak out because their mind doesn't want them to be truly relaxed. And that's what causes the night terror, is that going into full relaxation is stopped by the anxiety. Really interesting theory of it, but again, that hasn't been tested, or it can't be tested, but it is a interesting theory on why we have night terrors. Though, as I said before, the majority of those who have night terrors is children. The next is nightmares. So again, different than night terrors because nightmares occur in REM sleep. And these are these frightening, anxiety-producing images, things like spiders, snakes, falling, and after waking from a nightmare, the person can typically describe the nightmare in great detail because it's going from REM sleep to wakefulness, which are really close together. You don't have that relaxed, shut-off brain. Last thing we'll talk about is sleepwalking. So sleepwalking, this also, like the night terrors, occurs in stages 3 and 4 deep sleep. And this is where the sleeper will get up and walk while fully asleep. They tend to have poor coordination. They're clumsy, but they can avoid objects. They can even engage in conversation, but they have no memory the next day. Some people that do sleepwalking also do night eating. They'll sleepwalk to the fridge and eat. People who have this issue actually put locks on their fridges to prevent them from doing it. Some people who do sleepwalking, it can get them hurt because they can walk out into traffic, stuff like that. Sleepwalking, again, is in that deep stage of sleep, so it's not due to dreams. There's a myth about sleepwalking that you shouldn't wake up someone that's sleepwalking. That is a myth. You should wake them up, get them back to bed, get them safe. It's not going to be harmful to them to wake them up. Yeah. So that is the end of sleep and dreams. So we looked at a continuum of consciousness, sleep and dreams, rhythms of consciousness, circadian problems, the stages of sleep, the seasonal affective disorders, some theories of dream interpretation, and then finished up with some of the sleep problems and treatments. Thanks, come on back.